and you are a primary care physician. As I mentioned at the top, you serve the underinsured and the uninsured in the greater Lansing area. And uh, what are some of the unique challenges that Carefree Medical is facing when trying to help these communities during a pandemic like COVID-19? And what are some of the steps that you are taking to help treat your patients for their everyday needs?
Mhm. As I see it, as a primary care provider, uh, my main responsibility right now, one of the most important things that I can be doing is keeping my patients out of the hospital. So my patients with diabetes whose blood sugars are really high, I need to make sure that those patients are getting treated appropriately so that they're not ending up in the hospital. Or people with uncontrolled high blood pressure, I need to make sure that we bring their blood pressure down so that they don't end up with stroke symptoms in the ER. Because the hospital needs to dedicate every single ER bed and every single hospital bed they can. They need to donate all of those beds for the coronavirus. And so my biggest responsibility is to make sure that people that aren't infected with the coronavirus are staying well enough to stay out of the hospital. Patients with mental illness, 50% or more of what I do every day is depression, anxiety, bipolar, schizophrenia. And keeping those people stable and out of the hospital, again, is going to be in the best interest of public health. It's going to, limit exposure between patients and between providers and patients. So the biggest thing that we're doing at Carefree and the biggest thing that primary care providers are doing across the country is trying to keep our patients healthy enough to stay out of the hospital. We're also obviously taking precautions to keep ourselves and our staff safe. My biggest concern as somebody who employs, roughly 34 people is the health and safety of the people who I employ. And I need my staff to feel safe when they come to work every day. So we've instituted some best practices to screen people, every single person who calls our clinic to schedule an appointment, as well as every person who's already on the schedule. We are calling each of them, screening them for symptoms of coronavirus, asking them if they have a fever, cough, or shortness of breath. And if they have any of those symptoms, we're encouraging them to not come in. We are ordering tests over the phone. We have the capability here in Lansing to do drive-through testing. And so for people who we think need that service, we are ordering it. And for people who just have mild symptoms, we're encouraging them to stay at home and allow their immune systems to fight this off naturally over the course of 2 weeks. So we're doing our best to screen individuals and make sure that the people who are coming in don't have symptoms, but also warrant being here. Um, so we've also embraced telehealth. One of the things that Medicaid has done in our state is they've started reimbursing providers to do visits over the phone. So for people with mild illness, or people whose depression and anxiety are reasonably well controlled, people whose diabetes and high blood pressure or asthma or COPD are well controlled, we can talk to them over the phone. We can refill medications over the phone, and that way we're making sure that they don't come in. Our elderly patients, people over the age of 60 especially, we're trying to do our best to conduct those remotely. Only in certain cases are we encouraging them to come in, like people who have an urgent health need, like people whose blood sugars are through the roof or blood pressures through the roof. Of course, we need them to come in and get it under control. But otherwise, we've switched already to a hybrid approach between in-person visits and telephone visits.
If one of your patients or someone is showing symptoms of COVID-19, what steps should they be taking to care for themselves right now? And when is the appropriate time to seek more advanced medical treatment?
So, still, most people who develop or who are infected with coronavirus will develop just mild symptoms, a cough, maybe a fever, shortness of breath, a flu-like illness. So if you think about the worst flu that you've ever had, you had a high fever, you had a cough, you might have had trouble breathing, you definitely had muscle aches and body aches, and those are the kinds of symptoms that people might get with coronavirus. And if you have any of those symptoms to a mild degree, then I would encourage you to just drink a lot of fluids, take Tylenol, and stay at home and give your body a week or two to fight it off. The time to seek additional care is if, for example, your cough or shortness of breath uh, deteriorates to the extent that you might need help with your breathing. Maybe you need supplemental oxygen, or maybe, God forbid, you do need to be connected to a ventilator. So if you notice that you're having a particularly hard time or difficult time with your breathing, then absolutely go in to the hospital and seek care. But if you just have mild symptoms, you just have a slight cough or uh, uh, a low-grade temperature, I would encourage folks to stay at home and fight that off at home.
Well, thank you very much for sharing those practical tips. This is a very concerning time for a lot of people. You talked about mental health issues. You talked about the underlying conditions that many people are facing. And I am wondering, what are you telling your patients, and what would you say to people around the world who are scared about this pandemic?
Well, first of all, I'm normalizing the experience. It's okay to be scared. And none of us know exactly how this is going to turn out or when it's going to be over and when we're going to be able to get back to living our lives that we were living them before this happened. And so, one of the things that we are unfortunately seeing is a worsening of depression and anxiety during this time. People are maybe becoming restless, having to stay in their homes. I would just encourage people to remain calm, to remain patient, and to understand that that uncertainty is there and it's with all of us, and we all share a great deal of concern, which is why it's so important for our government leaders, especially at the federal level, to take more leadership and to tell people across the country that it really is best for everybody to just stay home for at least for the next 2 to 4 weeks. It's really, really important.
Dr. Bhatti, I really appreciate you taking the time out of your very busy schedule. Uh, so many thanks to you, to your staff, to all the frontline medical workers who really are standing in the breach in this tragic time. Thank you so much for joining us today.
Thank you, Chris. Thanks for having me.
I'm Chris Moyer, and this has been a Z Prime Now special report. Thank you.